Warm greetings, everyone. My name is Dorothy Guerrero, and welcome to Global Justice Now interview series, Global Perspective on the Coronavirus Pandemic. In this collection of interviews, we focus on news and analysis from leaders and representatives of social movements and progressive groups from southern countries that are collectively addressing the pandemic. The world continues to battle COVID-19. The number of new cases are still rising each day as infection reach more people in more areas. The virus has also shown how it is possible to make drastic changes in an incredibly short space of time. Today, our focus is on Kenya, which is facing the triple challenges of recent flooding, the worst level of locust infestation in East Africa in the last 25 years, and now the coronavirus pandemic. COVID-19 poses incredible risks to those living in Nairobi's densely populated urban settlements, where access to water, soap, and sanitation is unreliable. Keeping physical distance in shanties, crowded communities, and public areas is next to impossible. While some Kenyans can adapt to working from home, for many, living in urban settlements a day away from work means a day without food on the table. Likewise, in rural areas, Kenyan farms have drastically reduced export volumes to Europe by half, with a sizable number of them suspending exports altogether. Today, I will talk to Njoki Njehû, a committed grassroots organizer. She's a popular educator, a Pan-Africanist, and a feminist. Njoki's expertise includes women's rights, land rights, gender justice, community rights, and environmental justice. She is the coordinator of the Pan-African Fight Inequality Alliance, board member of Urgent Action Fund, or UAF, Africa, and Natural Justice. Hello, Njoki. How are you?
Hi, Toti. Hi, I'm fine. Thank you for having me.
Yeah, thank you for giving me your time today. I know that many people may not be aware about the situation in Kenya. Can you tell us what's happening there, and also with the coronavirus still spreading in your country?
Well, I think that what COVID-19 has done is that, as it has affected every single country, but of course the impact is very different. And for African countries like Kenya, and I'm often having conversations with colleagues in Zambia, in South Africa, in Sierra Leone and other places, the impact of COVID-19 comes on the back or on the heels of decades of restructuring and austerity that has reduced the quality, the access to health, access and quality of healthcare, access of water. In fact, the two things, we've been saying that the two things that you really need to fight COVID-19, which is water, access to water, and healthcare in case you get infected, are the two things that for decades the World Bank and the IMF insisted that countries in the global south decimate by limiting how much governments could invest, by pushing the privatization model. So we find ourselves very vulnerable. Everyone is vulnerable, but many countries, especially countries that had huge debts in the past, find themselves very, very vulnerable and really very handicapped in terms of responding. And so, as you have described in Kenya, this comes on the on the hills, right behind the locust infestations. And right now, the flooding is also actually still going on. And at the same time, you have COVID-19, and it presents a huge problem both for the government in terms of coping and responding, and also for people whose livelihoods, whose access to water, access to healthcare, ability to pay, and all of those kinds of things are quite limited. So it is a terrible situation. I don't think it's unique to Kenya, but it is a tragedy that this is what countries in the global south have to contend with.
Yeah, thank you for linking the structural problem with the COVID-19 pandemic. From what you've mentioned, it looks like your in the midst of many fights and many struggles in your country. So what does your organization do? Can you tell us more about your organization? Where do you work in? What sectors do you mobilize and organize?
Yeah, so I would say that I wear two hats. One is of the Daughters of Mumbi Global Resource Center, which is a autonomous women's network that is doing and has always done a lot of work around women's land rights, gender justice, mentorship, and food rights. And that work, obviously, when you work in community, being able to meet face-to-face with people, to visit together is essential, and of course that has not been possible. In fact, our International Women's Day event and celebration, which we had scheduled on the 14th of March, we cancelled because on the 13th of March was the first time a positive case was reported in Kenya. So that organization and that network gives me very close links to the ground, to ordinary people, rural and peri-urban people in communities that are quite impoverished and quite disadvantaged. The other hat I wear is that of the Fight Inequality Alliance, which is a global alliance of community-based groups, artists, youth organizations, women's organizations, groups and that work in communities in the urban settlements, in the informal settlements, and also includes trade unions as well as international NGOs. I am the Pan-African coordinator, and as I mentioned, it means that I'm also talking to people in other African countries. And the work that we are doing, both from the membership of the Fight Inequality Alliance and from DOM, is that we are staying in touch and responding to very, very everyday basic needs that people have. Whether it is water service, whether it is doing food packages and all of that. Fight Inequality Alliance as an alliance doesn't do that, but our memberships are deeply and fully committed and engaged in responding, doing food packages, providing water and sanitizers and sanitary towels for young girls who are out of school. And all those kinds of things are the things that our members are doing. But for Fight Inequality Alliance, we are really focusing on the structural issues. We have seen, not just in Kenya or just in the Global South, policies and proposals that we have had as progressives that we really would, 4 months ago, 5 or 6 months ago, now we're already in June, 6 months ago, we would have been laughed out of serious policy conversations if you were talking about things like, privatizing hospitals, as we saw happen in Ireland and in Spain, talking about providing free healthcare as needed and free testing. Those are things, the mantra of the World Bank and the IMF, the mantra of neoliberalism was about public-private partnerships, sharing cost and, user fees and the rest of all that language. But what has happened with COVID-19 is we have seen those proposals that we have been saying and that we've been putting on the table being adapted. We saw the G20 before. You and I know how many years it took to get these institutions to agree to the idea of debt relief. And we saw the G20 step up and offer a debt moratorium. Now we can talk about the quality of it and what it does and what it doesn't do, but these are arguments that we've been making for a long time and they were not going anywhere. So for the Fight Inequality Alliance, we want to focus on those structural questions and those structural issues so that we actually see an enhancement, an increase of the measures that have been put in place instead of them being rolled back once the crisis is over.
I'm happy that you have mentioned your policy campaigns and also the mobilizing around the issue of foreign debt. And here in the UK, one of the first campaigns that we revived with the start of this pandemic was to cancel the debt of developing countries or third world countries. And many of those who are sympathetic to that campaign understood why. That instead of money being sent to international financial institutions, the indebted countries needed those money to cover healthcare, to improve their infrastructures and all that. In Kenya, is there a wide support when you say that we should stop paying our debts and instead use the money for our welfare and to address the pandemic?
Well, I mean, I think once people understand what it means to have the debts cancelled, people support. But there's a lot of confusion because, as you know, part of what the IFIs, the international financial institutions, and the lenders did in resisting debt cancellation was to sow confusion and raise issues of governance and corruption and all of that. So for a lot of people, when they hear debt relief, if they do not understand, and this is the work that as activists we need to do of educating people so that when we mobilize them, they understand what it is that we are talking about. When you talk about debt relief, it means you hear people saying things like, oh, it means that the corrupt government officials then get away with it. But when you explain that what you're talking about debt relief is that instead of them sending the debt service to the World Bank or the IMF or the UK or some other country that is a lender, they would have those resources available to use for meeting the needs of citizens and people in Kenya. Then people understand it. Interestingly enough, the Kenyan government has refused to take the debt relief that is on offer from the IMF, saying that they want to leave the option of access to capital markets open. And we are like, what capital market? For what purpose? I mean, who are you serving by saying you want to keep the access to capital markets open? Whose interests are you really serving? Because the people who need and who want access to capital markets in Kenya are a very small fraction of a percentage. I wouldn't even hazard a guess, but it is a very, very small number of people that probably you could count, in a dozen or two, but not, it's not something that people in Kenya think or need for that matter. What they need is safe drinking water, is healthcare that actually is available for everybody, irrespective of whether they have health insurance, ability to pay, or any of those things. That if you're sick, then you can get treated. So those are the things that are needed, and that's what we're saying. So that as Kenya borrows like a drunk, it's like unbelievable. Right now, Kenya has gotten about $2 billion in new loans, and this whole fighting COVID-19. And we are saying we need to really pay attention in terms of accountability, in terms of transparency and prudence in terms of how that money is spent. Because bailing out big corporations, bailing out the Kenya Airways, the national airline, bailing out, there's now a hue and cry about the hospitality industry here in Kenya, and they talk about the hotels that are closing. They never talk about actually the workers who lose their jobs or who lose their livelihoods, and the associated people who are part of that industry. So we are really very concerned to make sure that we don't lose our focus on what is needed, which is putting people first, not corporates, not businesses, but ordinary people who, as you say, they are day wage earners who it means we have a lockdown and we have a curfew in Kenya, by the way. So the curfew was just extended last week, but there's a curfew that goes from 4 a.m. until 9 p.m. to 4 a.m. every day. and it means that for many people it was actually going from 7 p.m. to 5 a.m. 7 p.m. to 5 a.m., which meant that people couldn't go to work. People needed to be
Or those in the
getting
night
home quite
shift, how do they go home?
There was absolutely no night shift. And in Kenya, I have to say, we don't have a lot of 24-hour economy jobs. There are some, but not very many. But it also meant with like social distancing, when most people depend on public transport. The first few days of the curfew saw huge police brutality against people who were caught outside their homes after 7 p.m. Now it's been moved until 9 p.m. from 9 p.m. And what it means is that also the working day has been stretched a little bit. But until today, restaurants were only allowed to be open until 5 p.m. They've now been extended until 7:30, but the curfew is still from 9 p.m. So all of these things, they must be done. Physical distancing must be done. All of those things must be done to ensure that actually, people stay healthy. But at the same time, they must be met with measures, that will be that are intended and that are in place to make sure that people don't just suffer.
And is there an initiative, or are there platforms where the various organizations, various movements come together to develop a common demand or a set of demands, either to the government, to the international partners, for building unity, and at the same time to propose concrete ideas on what kind of society is needed after this, or you want to build after this pandemic?
Njoki, as you know, progressives and civil society have never lacked ideas and alternatives that they offer to government. What we've often had is a resistance from government saying that is not workable, that is, it's labeled as, I don't know, communist, it's labeled as, anti-establishment, or however they were anti-democratic, however they want to label it. We've seen people in the US take to the streets to protest because of the lockdown, saying they want to go get haircuts and those kinds of things, and not paying any attention, not caring about the people who would be working, not caring about the public health, the public interest. We've seen that, people oppose sensible, fair, just measures that are supposed to actually take care of the common good and take care of the most vulnerable and ordinary people. So there have been people who have come forward, organizations that have civil society that have come forward to address and to make suggestions about what the government should do, for instance, on the issue of debt, on the issue of providing support, and anything from basic income support to care packages, to providing water and sanitation and washing points in the slums, in the shanties, as you refer to them, because those places, they don't have running water, they don't have toilets, they don't have space. People live in very cramped situations. And if you're saying to people, social distance, people can't even social distance inside their own house, let alone outside their doors. So there have been a lot of proposals. There have been responses to police brutality. There have been responses to how they've been handling. We saw with the testing for COVID-19 being very expensive. Even at the time when government was saying restaurants could reopen under very strict measures, most of the restaurants didn't open because at that point it was costing about $100 per person to get a test. It has come down. It hasn't completely come down. I happen to think, when they talk about raising $2 billion to respond to COVID-19, part of that is to provide free testing for COVID-19 for people who need it, not just people who are suspected, who are traced as having come into contact with people who were exposed. But back to your question, there have been proposals on better policing, on how to get in basic income support to people, on what to do about the debt, on what to do about healthcare. The Kenya Fight Inequality Alliance actually issued a statement to government in March, before the end of March, just when things were really beginning to kind of get crazy and people realizing what was going on. And we called for free testing for anyone and everyone who needs it, and treatment as well. We called for the government to join efforts with other African governments and do a debt moratorium, not like what the G20 has offered, but a debt moratorium where the interest doesn't continue to accrue, and that with an eye to actually getting the debts cancelled. And then, of course, issues around public safety, around policing, all of those things. Those issues have been coming up, and government has definitely had plenty, both in terms of initiatives within the country, but also global solidarity initiatives, whether it's the vaccine issue, all those kinds of things. Kenyans are very much on top of them.
Yeah, and those issues are indeed global calls, not just in Kenya, but also worldwide, even here in Europe. So you have mentioned global solidarity. So what are your thoughts now about internationalism, building bridges and movements of movements? So maybe that will be my last question. What do you think of the need for global solidarity now? Is there a potential to build it better and wider and stronger?
I think both the climate justice movement, the anti-debt movement, the women's movement, there have been a number of social justice movements for decades that have called for international solidarity and the need to act in concert and to act as if we are on the same planet, not as if some of us are here and others are there, and the impact of climate is something that we can, to use the language, mitigate against depending on where we live. But both the COVID-19 crisis, the pandemic, and of course, in the last almost 3 weeks now, the Black Lives Movement, the Black Lives Matters movement have shown the importance of global solidarity, have shown the importance of people acting together. We are not immune. Others have said that we are as strong as the most vulnerable amongst us. And it's whether it is on matters race, whether it is on matters COVID-19, whether it is on matters of climate justice, we are as safe and we are strong as the most vulnerable amongst us. And if the last 6 months haven't given us reason after reason for acting in solidarity, for behaving as if we are on one planet and that there is no planet B, regardless of where we are, how much money we have, then we are missing the boat. I want to answer this question by saying two things. One of which was that in Kenya, and I think this has been true in many countries, where governments have decimated health systems, hospitals don't work, the wealthy, the people, the able, the financially able have always been able to fly out. In Kenya, people go either to India, to South Africa, and to the US. To the UK, some, but the US, India, and South Africa are the most popular medical destinations. Well, with COVID-19, no one could fly. They who have failed to support the public healthcare here, who have decimated, who have been part of decimating public health institutions, were stuck with the rest of us. Mm-hmm. And if that did not give them pause, I don't know what would. And mind you, even to the extent that when people go out, it may be like somebody is able to go, their nuclear family, but their extended family can't go. But now, not the nuclear, not the extended family, which was also at great risk, and everyone has been at great risk. The second thing that I wanted to share about this movement is that about a month ago in Kenya, we had a moment where what COVID-19 and the lockdown has done is that it has really forced us to be innovative, to be creative. And what we had was an online digital concert that was done by an artist that that we work with here as Kenya Fight Inequality Alliance. And what was unique about this concert, one, is that it was live. It was not taped. It was a live concert broadcast on digital platforms, Facebook, Instagram, and YouTube. And the other thing is that a lot of the concerts that are being done now are to raise money for different things. But this particular concert was different in that it was a movement for an hour and a half to get people to focus their demands to government, to the president, to the State House. Our White House is called the State House. And for that evening, last month, on a Sunday evening, people were tweeting, people were talking, people were watching and listening to music that raised issues about inequality, about police brutality and extrajudicial killings, about gender issues and all the rest. And these are the kinds of things and kinds of movements that we keep seeing now under COVID-19, where people have to figure out how do they use the resources, the talents that they have. We have seen artists, that was one artistic expression. In Kenya, I don't know in other countries, in Kenya for the first few weeks of the pandemic, the briefings and the information that government was providing was all being done in English. So Kenya Fight Inequality Alliance members pulled together and worked with a team of activists who could go on local vernacular radio in about 10 different languages and talk about these very complicated public health issues, the protocols that were being mentioned and all of that in languages that people could understand. Artists in the informal sectors went and did graffiti along the walls about washing your hands, about wearing masks, about social distancing and all of that. And I think they did a great service to this country and to communities that really were being left out and were hearing very scary information, were feeling completely incapacitated by the fact that it was this disease, you needed to be tested, you needed to be quarantined, what would happen to your family, what would happen to your livelihood. So this moment is a moment of crisis and a deep one and a very serious one, but it is also one that is calling the best of us in terms of our skills, our talents, our links and our solidarity. And we must really value that and understand how much that is needed and how well it works in terms of fighting huge battles like the one that we're facing.
Njoki Njehû, thank you very much for your powerful words. It is truly inspiring and shows us that in the midst of all these uncertainties, we can find positive ways and solidarity ways of acting together. Thank you very much. Yeah. And we are with you in your struggle.
Thank you. Thank you for having me.